Every year since its inception in 1987, the Baldrige Performance Excellence Program has identified organizations that have demonstrated quality and performance excellence and recognized them with the Malcolm Baldrige National Quality Award. The 2010 recipients join 84 previous honorees as the best of America's best in manufacturing, service, small business, education, healthcare, and nonprofit. Studer Group is a Baldrige recipient.
Studer Group's a performance-based consulting company that works with primarily healthcare providers across the country to improve their operational performance. Our mission is to make healthcare better for patients to receive care, employees to work, and physicians to practice medicine. We don't take care of patients, so we have to make sure we can create that culture in those we serve.
So let's talk about rounding on staff. Do you feel like that's happening 90% of the time?
Our vision is to be the intellectual resource so people, leaders in healthcare organizations, can maximize themselves and others' performance.
Some hospital environment.
So we needed to create tools and techniques that wouldn't only work in a 20-bed hospital, but work in a 1,000-bed hospital.
Are we keeping it under control for
So we really work with organizations on what we call evidence-based leadership, showing leaders if they do certain things a certain way, they'll get better execution.
The number one strategy that we can do as chief nursing officers is to ensure that we are rounding on every one of our patients every day.
It's going to tell you your data and how you're doing compared to those goals, and then if you want to see what tactics are you doing.
So what we're asking organizations to do, we see get the best results, is at least 10% of your patients.
More or less, we're actually taking care of those that take care of the caretakers. We're trying to create a leadership culture where the caretakers and those that support caretaking gets attention. We literally had to show that the hospitals or the healthcare systems we work with, not only did they feel good about the Studer Group, but really that their patients felt better about the care they received in those hospitals. So we had to really demonstrate that our customers' benefited from our tools and techniques.
Now this is an area where I'd say you're not having some consistency.
Right.
Our goal is take your current process, maximizing it to the fullest point. Then you know where you can go. Then it becomes so evident you have to innovate that now innovation becomes a necessity. We're constantly looking for innovation, but we're constantly looking for what we call tweak innovation.
Okay. Do we have any physician?
We call it eating our own cooking. If you're not willing to eat your own cooking, you can't do this, because there's a lot more pressure on us because, again, when you teach it, you also have to do it. That's why the Baldrige journey was so important to us. You know, we had so many of our clients win the Baldrige and apply for the Baldrige, and we felt that we needed to also be on this journey with it.
Congratulations to Studer Group. It has taken its place on the honor roll of Malcolm Baldrige National Quality Award recipients, taken its place among the best organizations the United States has to offer.